and Bala Nagendran, Akashvani Correspondent.
Sickle cell anemia is a disease that impacts the tribal sections of the society significantly. The government is committed to eliminate sickle cell by 2047. This was the statement of our Honorable Prime Minister while he launched Sickle Cell Eradication Mission in Madhya Pradesh. To talk us more on the mission as well as further developments, we have with us Additional Secretary, Ministry of Tribal Affairs, Ms. Jaya. Ma'am, welcome.
Thank you.
Ma'am, first I would like to start from the basic question. What do we mean by sickle cell disease?
It is a blood disorder. When we are talking about sickle cell disease, what do we really mean? What we mean is that in a normal person, a person who is not having sickle cell disease, the red blood cells are round in their shape and they move smoothly along the blood vessels. But when a person has sickle cell disease, the red blood cells become sickle cell shaped. They become crescent moon shaped, and therefore they may cling to the lining of the blood vessel, or it would be difficult for them to flow in the same manner as a normal red blood cell, and therefore the person experiences a lot of symptoms which can become very difficult for him to lead a normal life, and it is possible that his longevity may also be affected. So he will have what we call pain crisis, where his joints would be paining very terribly. Without medical attention, it cannot be handled. He may develop jaundiced eyes. He would be showing yellowed eyes. He would be having frequent fevers, fatigue. His immunity would be compromised. So these are the kind of symptoms, and if they are ignored, of course, there could be gradual organ failure also, and he may develop other kinds of diseases. Hence, it is essential that we need to know what is the status of a person, especially in these areas where sickle cell is said to be endemic.
So, in that sense, if we look at mission and its focus, we have come across that 17 states have been taking this into mission mode. That is sickle cell eradication. So, I would like to ask you, is there a role of geography that plays a pivotal role in spreading this sickle cell?
See, in studies it has been found that these 17 states, especially 13 of them which are in the central belt and the southern belt, the states with tribal dominant population, we find that sickle cell is also endemic there. It does not mean that it is present only in tribal population. There are non-tribal populations also which are affected, but it is found more amongst tribal population. It is said that sickle cell is a genetic mutation to ward off malaria. But I must also add that sickle cell is a hereditary disease. And as a hereditary disease, the mission's ambition and the mission's goal is to stop the intergenerational transmission of the disease. So that is where this mission comes from.
So in that sense, as you talked about the mission, I would like to ask you about the objectives of this sickle cell eradication mission.
The sickle cell eradication mission was announced in the budget of 2023-24, and it was launched by the Honorable Prime Minister at Addl, a district in Madhya Pradesh, on the 1st of July. Its objectives are very simple. Its objectives are to stop the intergenerational transmission of the disease, to eliminate sickle cell disease from India by the year 2047. It aims to screen 7 crore people in tribal dominant areas and also in the age group of 0 to 40 years, which means newborns to 40 years. And it's also going for awareness generation and counseling through a process of awareness generation counseling of the people who are screened and people in these areas. So this is basically the objective of the sickle cell mission.
As the objective also has highlighted the necessity for coordination. So from being in Ministry of Tribal Affairs, so Madam, could you explain how Ministry of Tribal Affairs is coordinating with the Ministry of Health and Family Welfare to achieve these objectives?
See, the lead ministry in the mission, because it's a very, very technical subject and the Health Ministry is the lead ministry. This is a part of the National Health Mission. This mission is also a part of the National Health Mission. The Ministry of Health and Family Welfare has drawn up a list of stakeholders and has assigned certain roles to them. The Ministry of Tribal Affairs has a very prominent role. In fact, it is to that extent the ministry which has been given the responsibility of awareness generation, assistance in counseling, and assistance in screening. So what we mean by this is that in tribal areas especially, you will find that the health seeking behavior, when people go to the doctor, when people seek medical attention, who is the person whom they see, what is the circumstance under which they are willing to go in for this kind of a screening or something like that. So what we call the health seeking behavior, that is determined in tribal communities through many factors. Their traditional healing practices, the efficacy of their traditional healers, access to public health, the affordability of public health, and what is it that they know about the disease. So all of it determines their health seeking behavior, and therefore awareness generation is something that is very, very important when it comes to a mission like this. And the Ministry of Tribal Affairs has the responsibility to ensure awareness generation amongst especially the tribal communities in this regard. I will take this opportunity to invite the entire public of India to join us in this mission. There are many ways in which they can contribute. So each one of them can contribute in their own way in spreading the word about what the disease is, how it is transmitted, and how we can prevent it.
While we talk about participation of stakeholders, we also need to introspect about the roadmap that we undertake as well as the challenges that are in front of us. So ma'am, could you tell us the roadmap by which the mission is going to travel as well as the challenges that we have ahead?
The kind of challenges that we have are of course about awareness. If people are aware about what this disease is, how it is transmitted, how they can avoid it, it will go a long way in ensuring a certain behavior which would help in management of the disease and also in prevention of the disease. Because when we look at the kind of way in which this disease is transmitted and our aim is to stop that transmission, we will find that there are three kinds of people who can be found. One is a person with normal red blood cells. The other is a person with sickle cell trait who is a carrier but does not show any symptoms at all unless that person is screened. The third is of course the deceased person, the sickle cell deceased person who will exhibit symptoms of the disease. So those people may perhaps go in for screening sooner rather than later, but the triad people may not. So what we say is that in Hindi we say Kundli Milana. While you are matching horoscopes, match your blood types also. If there are two people who are both triad positive, who are both carriers of the disease, we advise them, counsel them not to marry, because then the likelihood of having a child who is diseased is much, much higher. For each pregnancy, there is a 25% chance. So counseling before marriage, if two triad people have married, then counseling before conception that there is a likelihood, and then counseling after conception, where if the lady is found to be positive or her husband is found to be a triad person, a carrier, then we advise them about the options available, and there is also an option of going in for in vitro, that is the fetus in the womb can be tested and the couple can be counseled on the next few steps that can be taken, and at least they will be aware that this is a child which is going to be born with the disease, and the management of the disease would begin from day one. So there is a lot of counseling that needs to be done, and that will come only through an awareness generation about the debilitating effects of the disease.
And while we talk about the sickle cell disease, and we should also speak about the tragic fact is that those who suffer from sickle cell will end up becoming disabled. So in that aspect, could you explain what are the government benefits those who are affected by disability due to sickle cell can avail from?
See, sickle cell disease has been recognized as a disability, and the disability certificate is now given for a period of I think 5 years. So we have requested that there should be a permanent disability certificate, especially where the disease has progressed much. A permanent disability certificate is now under examination. So it is recognized as a disability, and all the benefits that require to be given, all the government schemes that are applicable would also be applicable for sickle cell disease. with reference to whatever is that particular disability. So those benefits would be extended to the sickle cell disease. In addition, we are also looking at how we can make people aware of, especially to the caregivers. We have developed an awareness module and a counseling module through a committee of experts where we are targeting specific groups for awareness generation and specific groups for counseling, especially people like teachers. They are there with the children for such a long time. They should be aware of this kind of a disability. What is it that needs to be done? For instance, there is an advice that sickle cell people should be drinking more water, which means their urination is also more frequent. But if a teacher or an employer does not recognize this, then the person is likely to be troubled. So we are saying that these are the kind of things that caregivers must be aware of, or people who are with sickle cell disease people must be aware of, so that they deal with the disability in a much better manner. Further, many state governments have also extended certain benefits in terms of nutritional supplements or monetary compensations to sickle cell disease people.
Awareness is the key to determine the successful conduct of any mission.
Absolutely.
Ma'am, in that aspect, what are the public awareness campaigns the government is undertaking, and could you highlight its significance?
See, in the first instance, the Ministry of Tribal Affairs set up an expert committee which consisted of a variety of people, medical professionals who have been working in tribal dominant areas for 2-3 decades now, people who are patient support groups, people who are hematologists. And what was the reason we set up the committee? To develop an awareness module and a counseling module. The reason why a committee was needed was because we wanted that no misinformation must spread. So we wanted a group of experts to develop a very simple module which can be distributed to as many people as possible in the field. And we also have developed a series of ways in which we could disseminate this information. One is through training of master trainers. We have already had one session of training of master trainers who would be at the state level. These we are hoping would be training the district level master trainers who would then be training the local level influencers, the Anganwadi workers, the Asha workers, the members of the Gram Panchayat, maybe the teachers in the area. So anybody who is an influencer, traditional healers, traditional headmen, especially in the tribal communities, these are two figures which are not officially very much known, but who are great influencers in their own local areas. So how do we approach these people? There is this kind of a training program that has been envisaged and which has been started. We are also in conversations with the Indian Medical Association, the Indian Academy of Pediatrics, the Association of Gynecologists and Obstetricians. We are also talking to other kinds of stakeholders, including patient support groups, and also those kind of organizations which can undertake this kind of a dissemination of information on a large scale. This is something we are doing on one side administratively. On the other side, a lot of information and material is being produced for both paid and unpaid advertisements in terms of audio clips and video clips, which are also being translated into a large number of tribal languages. So the idea is to bring about behavioral change, demand for proactive screening in such a manner that sickle cell disease as a dreaded disease is, not avoided but spoken about. And finally, people go in for proactive screening, and if they are found to be either deceased or carriers, they take the necessary precautions, and especially the deceased are able to manage their disease in a manner where their quality of life improves and where their longevity is also better. So this is the overall way in which we are working towards awareness generation.
Ma'am, thank you so much.
Thank you.
You were listening to a discussion on elimination of sickle cell anemia. The participants were R. Jaya, Additional Secretary, Ministry of Tribal Affairs, and Bala Nagendran, Akashvani Correspondent. This program was produced and presented by the News Services Division of Akashvani. You can listen to it on our mobile app, News on AIR. This program is also available on our YouTube channel, News on AIR Official.